This original WSRE presentation is made possible by viewers like you. Thank you.
Good evening, I'm Lloyd Patterson. Welcome to CTC. No question about it, cancer is a scary thing. We think of lung cancer, bone cancer, but really the most common kind of cancer is skin cancer. More than 1 million cases a year diagnosed, 68,000 melanomas, the more serious kind, more than 8,000 deaths a year. But look at this, the good news, 99% 5-year survival rate, so people live with it. Our guests tonight really know this topic very well. First of all, Michael McQueary. He has survived not 1, but 2 cases of melanoma and is here to share his story, which is under his hat a certain way. And Dr. Jack Kotlarts is a plastic surgeon practicing facial plastic surgery in Pensacola. Also is a teacher at the FSU Medical School here. Dr. Harish Malhotra brings more than 30 years of experience to the Sacred Heart Medical Oncology Group, practices at the Sacred Heart Cancer Center in Pensacola. And Donna Campbell is Director of Cancer Services at Baptist Hospital, overseeing the day-to-day operations at the Baptist Cancer Institute, where she previously served as a clinical nurse, manager of the oncology unit. Welcome to the program. Skin cancer is the topic, and it is way more common than I thought it was when I began looking into this subject. Do you think because it is so common, it's not taken seriously enough? Dr. Kotlarts?
Well, I think, as you mentioned, melanoma itself affects about 68,000 patients per year in this country. About 8,000 people die from melanoma every year. But we do love the sun. And as a consequence, we think of big cancers. To us, big cancers are breast cancer, colon cancer. So a lot of people really don't think of skin cancer as being the big cancer, although it certainly is the most common cancer.
Yeah, the big cancers versus the little cancer, but skin cancer is cancer nonetheless. Dr. Malhotra, not taken seriously enough?
Right, because like you said, there's about 1 million cases of skin cancer a year, but majority are squamous cell carcinomas and basal cell carcinomas. And their death rate from those 2 cancers is exceedingly small, as opposed to the most deadly form, which is melanoma, where the death rate is much higher. And yes, skin cancer is definitely there to be taken very seriously.
Donna Campbell, Baptist Hospital, do you think that is it hard to get your friends, is it hard to get people to get worried about skin cancer? I mean, we have the sun up all the time. We can't.
Well, I can almost convince them to stay out of the sun for their wrinkles, more so than I can stay out of the sun for their cancer. But
vanity over health.
Exactly. But when you mention melanoma, you talk about having a 99% survival rate, 5-year. That's if it's caught early. If it's caught later, late diagnosis, it decreases to 15%, and it can be very serious if it's not caught early. Whereas the basal cell and the squamous cells, you know, they can be treated very well.
All right, and catching it early is, of course, one of the topics that we want to talk about tonight, and the mole patrol and all that sort of thing. But first of all, Michael McQueary, as far as I know, you're the only one on this group that has actually had skin cancer, and you had melanoma first and then again.
Just had a little spot up here in the middle of my back is how mine popped up. Of course, I'm covered with freckles, so it's hard to distinguish. And I just went into my doctor, he caught it, referred me to oncology, and went in there. Ended up having to have surgery. It did come back positive. Had to have lymph nodes removed, and then most recently I had a brain tumor. It has moved to my brain. So as of now, they've got everything cleared up. I'm still going through checkups and scans and things of that nature to see that it stays in remission, but it really has changed my life pretty dramatically.
I'll bet. It moved from skin cancer on your back, it migrated to your brain?
Yes, sir, it did. Took about 3 years. I had just went back in September of last year and had a checkup and was all clear. Then back here about 2 months ago, I was due to go to work, and I had a bad headache I couldn't get rid of, and they scanned my head, and it had moved to the back side of the right side of my brain. So it moves all over your body. Skin cancer is one of the quickest moving cancers there is, from what I understand.
Okay. Dr. Mohatra, does this case sound
It's a very typical case. Yes, it's a typical case in the sense that melanoma first spreads by lymphatic drainage. So let's say when somebody's first diagnosed with melanoma, first thing you want to do, depending upon the depth of the melanoma, is to take out the regional lymph nodes or draining lymph nodes to see if melanoma has spread to the lymph nodes. So if it's a thinner the melanoma, lesser the chances of spread to the lymph node. But if the lymph nodes are positive, the prognosis starts to drop dramatically. And unfortunately, there is no real good treatment, unlike, say, let's say breast cancer, in which if the lymph nodes are positive, we have a lot more effective chemotherapy. In melanoma, we don't have very effective chemotherapy. And their options become limited, and they're treated by stimulating their immune system instead with interferon, and hope that their survival is improved somewhat. Like his situation, unfortunately, it traveled beyond the lymph nodes via the bloodstream into the brain. And melanoma, therefore, once it goes to the lymph nodes, it has the potential of breaking through the lymph nodes, and it can show up anywhere. It can show up in the liver, lungs, bones, virtually any part of the body.
Well, this is kind of a surprise to me. I thought that skin cancer sort of stayed isolated in that one spot. I didn't realize it could migrate to pop up in another part of the body. Is this now? We have some pictures, and okay, now granted, these are not, you know, things that are real attractive, but people ought to see, you know, what it is we're talking about. And Dr. Kotlarz, would you recognize that?
Well, I'd recognize as something as I would not want to have, but something that surely desires treatment. When we look at melanomas, again, we have to divide skin cancers in what we call melanotic and non-melanotic skin cancers. Basal cell and squamous cell cancers traditionally are very low aggressive, so those things can be much more easily treated than melanoma, which what we see here. Remember, when we talk about melanoma, we want to think about A, B, C, and D. A being basically the concept of asymmetry, a mole that looks uneven. One side is not the same as the other. B, basically, we want to look at the borders. Are there irregular borders? C, we want to look at the color, irregular pigment. And D, obviously, we want to look at the size. Most melanomas are greater than 1/4 of a centimeter. So that's a general skin check. We also understand, statistically speaking, an average individual, adult individual, has somewhere between 10 to 40 moles. Once we get past the number of 50 moles, we have a higher chance of actually developing melanoma. So really the concept, again, as you're focusing in this program, is prevention, prevention, and prevention. And again, look at the irregularity of this particular lesion. Pigment is off. It has asymmetry. It obviously has a wrong size or a large size.
Now you want your moles if you've got, excuse me, if you want your moles, if you have moles, you want them to be, what, perfectly round. They shouldn't be all sorts of funny shapes.
They certainly should be much cleaner looking than this particular one. Not all moles are perfectly round, but really, again, another relatively nasty looking. These are the obvious. The problem is most of melanomas that we see are not this obvious, or most of skin cancers that we see are not this obvious. And sometimes they can be relatively deceptive. So screening, prevention, and certainly having somebody look at who can actually biopsy or take a good look is really the way to do it.
Yeah, Donna, if they looked that bad, that, I mean, I could probably pick it out.
Right.
But
the other thing, Dr. Kotlarz mentioned the ABCD. I also like to add E, which is evolution. Is it changing? You know, did it pop up pretty quick? Is it changing in shape? Is it changing in color? Is it changing in symmetry? We like to add that one as well.
Well, thank goodness for the beach here along Northwest Florida, because it provides a lot of great tourism and entertainment for thousands and thousands of people. But there's a danger out there, and I know over here recently there was a mole patrol out at the beach, I think during the Blue Angels show. And when you do that, when you take a cross section of people like that, do you typically come up with, say, 1 in 50 people are going to have something that they really need to take a look at?
Well, we actually came up with almost 1 in 4.
Nope, 1 in 4.
We screened 450 people, and at least 100 of those had something suspicious. May not have definitely been melanoma. There were, I think, at least 10 cases that were very obvious like that were definitely melanoma. And this year, the youngest person we saw with melanoma was age 40. But last year, one of the individuals that we found was one of our 20-year-old lifeguards. So again, you know, someone who's out in the sun constantly may incur melanoma a lot sooner than someone who's, you know, just out doing day-to-day functions.
So you see skin cancer almost unheard of, say, in children under the age of 10, and then as each age group, it gets higher and higher.
Not necessarily true. As a matter of fact, in a pediatric review at some major institutions, 3% of all cancers in children are skin cancers. And melanoma can occur, and certainly has occurred in patients that I've seen under the age of 18. And skin cancer, although we think of it as adult disease, it certainly is not limited to adults.
As you look at these pictures from Pensacola Beach, and we'll be showing them again, in your field, and Michael, with your experience, and Donna, you must never go to the beach. You'd be, if I knew everything you knew about skin cancer, I don't think I'd ever set foot on the beach again, unless I was, you know, completely covered and had a big 3 hats on. Do you look at these girls here? They're just trying to get the best tan they can possibly get. Are they making a bad decision?
Well, they are making a bad decision, and it is hard. The sun has a draw, like Dr. Kolar said. I mean, we enjoy being out in the sun. That's why we choose to live in the Panhandle. But so much is just promoting awareness, and you can still go to the beach, and you can wear sunscreen and be safe. And some people are pre-genetically disposed to having skin cancer. My grandmother passed away of melanoma. My mother's already had some melanoma moles taken off, as have I. So if you already know you're predisposed to it, then it becomes that more important. But it's hard to
there's a hereditary
people.
factor in skin cancer. So if you know mom, dad, grandma, grandpa, you really want to, was that your case, Michael? Did others in your family have it?
My dad had prostate cancer, but he beat his. He had it in full remission. As far as the skin cancer, I don't recall anybody else in my family having the cancer. As far as mine was concerned, mine popped up in the middle of my back. My doctor told me it was kind of a strange place because I am not a sun god. I'm redheaded. I go from shade to shade whenever possible.
And was your back regularly exposed to the sun?
No, because even when I was young, my mother used to keep me in a t-shirt. She used to preach to me all the time, you know, you're redheaded, you're going to blister, and I knew it. If I went out in the sun and wasn't covered, I paid the price. And even as an adult, like I said, I try to get under the shade whenever I can. And if I go fishing or whatever, I've got the sunscreen on and I've got shirts and stuff to protect me, you know, so I just don't take the chance anymore.
All right. If you just joined us, we are talking tonight here on CTC about skin cancer. We have Michael, who we just heard from. He's got a hat on, and that covers some of the treatments that he's had for skin cancer. And we have 3 people who work in the field, a facial plastic surgeon, a cancer doctor, and we have someone who works with us, works with the mole patrol, and the people that are always looking for skin problems. But I read, and this is going to be really shocking to you, maybe you've heard this before, but if you have a sunburn one time as a child, it increases your odds, it about doubles your odds of getting skin cancer later. My question is, who the heck did not get a sunburn as a child? And maybe lots of them. Dr. Kotlar, did you ever get a sunburn?
I grew up in Buffalo, New York, so sun was not an issue for us, but probably not, but the majority of us certainly will. The problem with all of this is sun exposure and UV exposure is cumulative. It's not something that you have had and it doesn't affect you. It's an additive thing. And we think about adults and protecting adults, but we have to be very careful about protecting children because of a statistic that you've mentioned.
All right. Doctor, would you recommend that parents limit children's exposure to the sun?
Parents have to be very aware of this. I have a 17-year-old boy myself, and I have no control over them in terms of getting them to put on sunscreens. But that's where that song comes, that sunscreen advice. And it's very important that the sun damage is very cumulative. And unless, of course, they have genetic abnormalities in the family, like xeroderma pigmentosum, in which there's a faulty repair mechanism or DNA repair mechanism, those people get melanoma even earlier. And then there is this mnemonic called BANS, B-A-N-S, melanoma of back, upper arms, neck, and scalp, has a very poor prognosis. So these areas should be especially protected with sunscreens.
I can imagine, Donna Campbell, that you have a tough job as you try to educate young people. I can see you going into a high school and telling kids before summer, now make sure you don't go to get a lot of sun at the beach. Make sure you stay away from that nasty old sun, or you'll pay the price in 30 years.
Well, would rather educate them on how to be safe in the sun. Michael mentioned that his mom would, ask him to put on a T-shirt. Well, a T-shirt gives you the SPF of about a 15, which means you could stay out in the sun 15 minutes longer than you could without a T-shirt. If it's wet, that's only about half of that. So even if you have a T-shirt, you need to apply your sunscreen of an SPF of at least a 30, let it dry, then go out in the sun, and then always reapply within 2 hours, whether it says waterproof or not, and whether it says SPF of 80. So you still need to reapply it every 2 hours.
Some of them say that they stay on, they last for hours and hours, but you don't buy it.
They do say that, but if you read it on the smaller print of the bottle, it'll probably tell you to reapply every 2 hours.
Okay, and what about days that aren't sunny?
Even on cloudy days, you should have an SPF of 15 because the rays are ultraviolet A and B, and it's a whole spectrum of ultraviolet rays that you need the protection from. And so it's a misnomer that only bright sunny days would be harmful, and it's okay to go on a cloudy day without sunscreen. The answer is no.
Okay, let's see if we've covered these. I want to show the avoiding skin cancer. We have some things that I put together on this from various sites. They say no sun from 10 to 4 p.m., seek shade all the time, wear a shirt and hat and sunglasses, plenty of sunscreen, SPF 15 and above. You practice these procedures even on cloudy days, and avoid tanning beds. Now, let's hold the horses right there. Avoid tanning beds. There are a lot of people who enjoy going to tanning beds. They have good little businesses that they operate. You're saying that tanning beds are as dangerous as the sun and you should not go to them?
Definitely. Not only it's dangerous from a skin cancer point of view, but it also increases your wrinkles. There's definitely increased incidence of skin cancer, both melanoma and non-melanoma, from repeated exposure to tanning beds.
Is there a safe level? I don't know how often people go, maybe once a week or even more often. Can you do it every couple of weeks? Is that okay?
I think it's going to exactly correlate with how well you can tolerate the sun in general. And that's the thing with tanning beds. While laws have replaced restrictions that haven't been placed in the past, I mean, there's over 20 states that do not even allow tanning beds. But you can't just give a blanket statement of you can do this many minutes, this many times a week. It's very hard to regulate, so that's why there can be so dangerous.
Okay, and Dr. Kotlarz, I know that you probably deal with a number of women, well, probably men too, who want to improve their appearance, and they undergo facial plastic surgery of some kind or another. And one of the things that's valued in our culture today is a nice tan. And what do you tell your patients about?
I think moderation is the key to life. To say don't do it is something that really most people will not take realistic advice, but you can give them realistic advice. For example, 10% of all skin cancers occur around the eyes. A myth is that dark colored sunglasses will protect you. Not necessarily true. There are different sunglasses that absolutely offer no protection. So just because you have some dark colored sunglasses, it's going to protect around your eyes. But the same token, most of us don't apply suntan around our eyes because we're afraid it's going to get in our eyes, it's going to sting and burn. So you have to use a common sense approach in terms of education. Again, the tanning booths, one of the problems with tanning booths is 10% of all tanners in tanning booths are under the age of 18. We go to this cumulative effect. So I think things in moderation and things in education and protection, people don't really understand what SPF is. It really all protects us is from UVB. And again, it's not a full protection. At the same token, people believe, or at least have a misconception, that since tanning booths are primarily UVA, it's not a problem. But as you've mentioned, it's not true, because UVA is also dangerous. And in many tanning booths, the bulbs produce about 12 to 15 times as much UVA as the sun does. So I think education is really the key to all of this.
All right, many of us, and I want to get into skin color on this now. I'm more like Mike here. I'm appallingly white. In my, probably Northern European people, we're just like that, burn easily, very light skin. Is someone who has a darker complexion, Dr. Malhotra, or a Mediterranean complexion, are they at the same risk of skin cancer?
They are slightly less risk of getting melanoma as well as non-melanoma skin cancer. They have the melanocytes in the skin do give you some protection, but the incidence is not zero. There are melanomas in India, where I come from originally, and we used to see a lot of squamous cell carcinomas, basal cell carcinomas. So you do get them, but the incidence is lesser.
And say African American populations, do they need to be screened, Donna?
They still need to be screened, and again, it goes back to that cumulative effect of how much sun they've had over their lifetime. African Americans can experience a sunburn just like Caucasian can. It may take a little bit longer, and they may have a little bit more resistance, but if they have that burn, it can lead to skin cancer.
Okay, let's talk about treatment, because a lot of people, obviously, who've been in the sunshine many times, like the folks on the beach here enjoying the sun, at some point in their life, they're going to find out that they've got skin cancer. And when they find that out, what do they need to know first of all? There's different types of skin cancer. How serious is it? A lot of the skin cancer is hardly serious at all, is it?
Well, basal cell cancer is the least of the serious cancers, because basal cell traditionally does not metastasize or spread, but it can become locally aggressive. The main treatment for most skin cancers is surgery, early detection and surgery. And most cancers, even melanomas, can be well controlled if caught early. But surgery is still really the main option, the main treatment for most skin cancers. Now, there are some individuals who have multiple small basal cell cancers that can be treated with creams such as Effudex. But again, surgery is the main treatment modality for early skin cancer.
Because when we hear about cancer, most of the time we're talking about he's undergoing chemotherapy.
No, right? That's true in general in other forms of cancer, but in, like Jack was just saying, in melanoma, the next decision to be made is depending upon the depth of the melanoma or the size of the melanoma, how much of area around that needs to be taken out. And ordinarily, if it's less than 1 millimeter deep melanoma, you can get away with about 1 centimeter margin. But if it's anything more than that, you need almost 2 centimeters all the way around, wider excision to ensure surgical cure.
Mike McQuarrie, you've had melanoma twice, both times treated with?
First time was just surgery. They went in and they done an ocular cutout around the melanoma on my back, and they took out a pretty good chunk. I think that's where, with most people, they think that skin cancer is just something you could go in and the doctor can take care of it in 10 or 15 minutes. Some can be, but for the most part, if they're bad, it can be really nasty. The surgeries, I had to have lymph nodes removed. That was the first go around. I've actually had 4 surgeries in the past 3 years. The most recent was on my head, and I come through it, thank God, really well. And then I had to do 15 radiation treatments. And with my doctors and the people at Baptist Hospital, it's been a really better experience than I thought it would be. Mm-hmm. So I think the biggest thing is, like I said, most people think they hear skin cancer, oh, well, I can go have that lopped off in a second and there's no big deal. That's just simply not true with some of them. It's just not true. It will kill you.
Yeah, it's not something just your family practitioner can't just scrape it off in the office the next time you go in for a physical. It's really something that you need a specialist to look at, or
well, at least your dermatologist, you know, and
Okay.
they can identify what type of cancer it is, and if they need to send it off and get a pathology read on it, they can, and then make a determination from there whether or not you need surgery or radiation.
Let's take, we're getting down to our last few minutes. Let's take another quick look at the skin cancer signs. We've shown some pictures, and yes, they've been pretty unattractive, but it really comes down to this, and you can help me out if I'm missing anything. Change in skin or in a mole, scaliness, oozing, bleeding, the spread of pigmentation, or a change in the sensation around that area. Those are things. Would you add anything to those for signs of skin cancer? And you think most people can pretty well check themselves, or do you need a professional to be looking at you?
I think you need both. I think you need someone at home that can help you out and check your back, the back of your legs, bottoms of your feet, you know, typically places that you can't always see with yourself. It helps.
You can get it on the bottom of your feet?
Yes, you can. It helps to have someone else, you know, checking for you, but then also your primary care physician and your dermatologist. Some people may need to go see a dermatologist once a year.
Okay, and really there's an important fact too, as serious as it is, if it's caught early, there's a really high probability that you're still going to be with us for a number of years, isn't it?
It's true.
I mean, and you can't say that for every cancer. That's
Right.
for sure. Well, you all have been a big help, and I'm really surprised. Were you surprised that she said that 1 in 4 people they checked out at Pensacola Beach needed to be followed up because of some possible skin cancer? Does that shock you?
That's about the incidence in the general population. It's 1 in 5 in some form of skin cancer.
And we are in the Panhandle. I mean, we do love the beach here.
Okay. Well, if you'd like some more information about skin cancer, there's the American Academy of Dermatology. There's their website, aad.org, National Cancer Institute, cancer.gov, and the Skin Cancer Foundation, and there's their website, skincancer.org. There's lots of good information, and there are mole patrols running around. If you see a tent someplace that says Mole Patrol, just stop in and be checked out. We thank you very much, Mike. Good luck with you and your treatment. And Dr. Mohatra, thank you for joining us. Dr. Kotlar, it's a pleasure to have you here. And of course, we're glad to have Donna here too. Thank you for watching our skin cancer special tonight, and we'll see you next time here on WSRE. Good evening.